Hello, SSP families. Happy Sunday. Well, hi, Dr. Cow. So we're live today because we want to discuss the new AAP guidelines for weight and obesity management. But before we do that, while we wait for you guys to get on, I want to do a little bit of housekeeping so that you're all up to date about what's going on at SSP. First thing first is, while I do all this, then you also have time to get your questions in if you want. We're going to have a Q&A part of this live. The way that you can send questions is not in the comments, please. It's really difficult to get through the comments. But you can use the little question mark right here, the button, and then we can also bring them on screen so everybody can will know what we're answering, what question we're answering. So again, while I do this, while I do some housekeeping, you can start sending your questions. First of all, I wanted to remind everybody that now SSP is open on Wednesdays between 12 noon and 7 p.m. And here's the reason why. First of all, we used to do this before pandemic, so we're trying to go back to what we used to do before pandemic. Little by little, we're getting there. There are two reasons why we decided to go back to the 12 noon to 7 p.m. on Wednesdays only. One is that we wanted to open up some space on Wednesday morning so that we could start bringing back the live classes that we used to offer. And so we're getting ready to launch them again. We're redesigning them at the moment. And as soon as we're ready, we're going to send an email to everybody so that you guys can start registering. If you like what you're hearing, give me a couple of hearts. Second reason is that by being open until 7 p.m. on a Wednesday, we give you the chance to schedule a late appointment for an annual or for a sick visit. As we all know, we're getting some hearts. Yay! As we all know, things happen at 5 p.m. You get out of work and they call you from daycare that the baby has a rash and needs to be seen, and there you have it. So on Wednesday, we're going to be able to see you later than on the other days. Point number 2 is, we get this question, and it's kind of interesting and hilarious at the same time. We get this question almost every day. Do you guys accept same-day sick appointments? Yes, the answer is yes. So every day, if you have anything that comes up and you need to come in with your child, just give us a call. We are able to accommodate same-day sick appointments. Call us in the morning. 9 o'clock is the time for calling for same-day sick appointments. After 10 for anything else, whether it is you need a school form or you need to reschedule an appointment or schedule a vaccine appointment, which we'll get to in a second, 10 a.m. Same-day sick appointments, call us at 9 a.m. or 12 p.m., of course, on Wednesdays, and we'll be happy to help you. Point number 3, let's say some hellos first of all. Point number 3 is, as you know, we have a new COVID vaccine program for 2023. And we have decided to change things around because we were kind of wasting resources and we needed to make the best out of what we have, because the city and the government is sending us COVID vaccines, which we all of us pay for with our taxes. And so it's a good idea to maximize the resources. So here we go. And we sent an email about it, but I want to go quickly through the schedule. So for the Moderna vaccine, primary series, meaning first and second dose of the COVID vaccine, ages are 6 months to 5 years. We do those vaccines on Mondays, Wednesdays, and Fridays. The Moderna bivalent booster is done for ages 6 months to 5 years, is done on Tuesdays only. And for this product, we can only schedule 1 week at a time, 1 week ahead. So for this week, the 31st is the day we do still have availability. The next one will be the next Tuesday. Okay, we're not going to be able to schedule 2 to 3 weeks ahead, unfortunately.
The reasoning behind this is because we don't want to open a vial at 5 o'clock for 1 dose and then waste 9 doses. And we're just trying to maximize, it's not no skin off our teeth, our back, whatever, however you say it. But it's we just want to maximize resources and not waste anything, and get as and do the most with what we've been given by the city.
Exactly. So just let's finish quickly. The Pfizer product, the main primary series, which means again first and second dose of the Pfizer for ages 6 years to 12, is going to be on Thursdays only. And on the same day on Thursdays, we also are able to administer for the same age group, 6 years to 12 years, the Pfizer bivalent booster. We do not carry any COVID vaccines for ages 12 and over. The reason is we can't simply store it in our refrigeration system. So that's.
But there's plenty of all of our local pharmacies should be able to help us, especially Accurate. Danny has been fantastic. He gave me my bivalent. So
yeah, mine too.
Yeah.
It's true, Danny. So again, we're going to start answering some questions. Dr. Kaz is going to talk about the new AAP guidelines for obesity management. But if you want to start sending questions, you can use this question mark right here. You can type it and send it. We'll receive it and then we'll bring it on screen so that everybody can read what the question is. But in the meantime, Dr. Kaz, would you like to start?
Sure.
There we go.
Yeah, we got a few. They actually brought it to my attention with the new AAP guidelines regarding obesity management and treatment. I think last week the AAP put out new guidelines regarding obesity management, meaning the things that included were pharmacotherapy, medicines that were like appetite suppressants that should be considered at 12 years of age, and then bariatric surgery at 13 years of age, and intensive nutrition and family therapy treatment, throughout childhood. Honestly, I think you have to look. What you have to do is look at the big picture of. First of all, let me preface by saying I don't think it's really going to affect our management or how we've approached it. So if you haven't had any questionable management, I don't think you should expect it. So the backdrop of things is that, obesity has become an increasing problem. In 1980, they did a study and things like the rate of pediatric obesity doubled. And then in 2000, it tripled from previous to that. And then in 2018, they did another study and that had quadrupled. So what you're seeing is like this tsunami of pediatric obesity. And I think the way that practitioners feel is kind of like trying to hold back a tidal wave. So in our experience, that hasn't been the case. But as a broader nation, it has been the case. So I think that there is more urgency to try and approach and do something to mitigate it. And many of you have heard me say this, like in the first year and a half of the pandemic, there definitely lots of kids went off of where they were supposed to be. But what we've also seen in the last year, since I've had now more regular follow-ups, is that they tend to right the boat, after things get back to normal, and you're not spending 10 hours 5 feet away from the refrigerator and doing your remote learning, and then if you're a fast one, you get done quickly, and you got 5 minutes before the next thing's supposed to start. And what are you going to do? You're going to get a snack. So yes, nutrition plays a big deal in our health and who we're supposed to be, but I think that a lot of these measures are geared towards, and these decisions and guidelines are geared towards really the 1% to the 2% that are really need attention. And I think a lot of times the AAP will put out these guidelines so that the 12-year-old that really has tried everything and hasn't had no success and is really ready to losing self-esteem and getting into places where they may or may not have disordered eating, would actually benefit from medication and pharmacotherapy for appetite suppressants and such. So when the AAP puts out these guidelines, what it does is it validates need or necessity, so that kid who actually needs it is not going to get turned down by insurance. And I'm not sitting at their round table, so I'm not certain, but I feel like this is why the AAP is doing this. Kids that have done everything and tried everything and are ready to really fall into that spiral of what morbid obesity can do to us has a chance at 12 to do something. Same thing for bariatric surgery. I'm not so certain I would agree with all of that, but now they have an option, and I think it's really just to give the kids who have hit bottom, who have at their wits end, and the parents are at their wits end and have tried everything, to have options and to have them covered by insurance. With that said, I think the mainstay of things is really still going to be dietary counseling, nutrition counseling, exercise counseling, and we do that in general. I've had many of you that came in whose kids were off the charts, but on a lot of levels, that doesn't mean that you're unhealthy. Even so, if I had you at the 99th percentile, I would probably say something to the effect of, well, let's keep this in mind. Let's not have a lot of processed sugars or juices or drinks that can get absorbed very quickly in our system and increase our risk for prediabetes or diabetes down the line. BMI is not it's a decent screen, but it's not the end all to be all to health. An example would be Serena Williams. I'm sorry I'm using you, Serena, but if you put her BMI, if she went to a school forum with your Serena Williams BMI, her parents would get a letter that said, hey, you need to do something about this. And to be honest with you, Serena is 200% healthier than I could ever aspire to be, and by 200% healthier than most adults could aspire to be. So, you have to take it with a grain of salt. In our experience, we're not gonna, we have plenty of time and plenty of relationship conversation to address that with you before we get into that point where we're talking about needing pharmacotherapy or bariatric surgery. So I know it seems extreme, but I don't really think it really applies to our experience and most of what our community experience is in our practice.
All right. So in the meantime, we started getting some. Oh, it's fallen. We started getting some questions. The way to ask questions, please, is not in the comments, because it's hard for me to catch up. It's just by clicking on this question mark that you have at the bottom here on the right side. You'll be able to type your question. They will come through, and then one by one, we can go through them, okay? So let's start answering a couple of questions.
Sure.
All right. So first question, here. There you go. I don't know the name of this person, Sesbitten.
You don't have to.
But do you have an approach to discussing weight that you expect all of your providers to follow? We do.
I mean, there's no template. I think most of us are on a fairly sensitive plane when it comes to it. Several of us come from practices or environments or patient populations where it needs to be a little bit more of a pressing issue. But I think we try to be respectful. There was a question also about counseling with the child in the room. Yeah, you know what? As with all things, you can ask to have a private conversation, but to be honest with you, I don't like to hide anything from kids. So things can be said in a sensitive kind of way that in conversation that doesn't have to have any kind of like self-esteem, and we don't ever want it to have a self-esteem spin on the conversation. You know, we're not trying to raise. It'd be really boring to have a world full of size 2s. You know, we're made differently, and what our focus as pediatricians is to make sure that you're healthy, and your main focus is to have healthy conversations with food and nutrition, and that in the end of the day, you love yourself.
All right. So we answered 2 for 1, which I love.
I think I did.
Yeah. I don't know if we want to try this one. Can you discuss what you feel to be the root cause of obesity and overweight for a typical kid whose diet is healthy?
Oh, well, I mean, that's
a tricky one.
This is just an Instagram live. This is not an Instagram, like, 2020. I think nutrition, like, the problem started in the 80s, right? Where we had a lot more fast food, and that became part of our culture. If any of you knew me before, when I worked at Methodist, I always did a grand rounds, and one of my teaching on this, and one of my features was actually discussion on the documentary that Morgan Spurlock did called Supersize Me, where he ate McDonald's for 30 days, and it was it was a big eye opener as far as like what we put into our bodies and what big business is putting into our bodies, right? So I think that's a big deal. Your question is really like the root cause of obesity and overweight for a typical kid whose diet is healthy. To be honest with you, that's a little incongruent. Some kids are curvy and healthy at where they are. But if you're just flying off the curve, there's either an endocrine situation or a real caloric and activity discordance. And that's not to point a finger or anything like that. But it's just math,
All right, let's see if we get to the next question. Oh, we got a question about the COVID booster. So it's a question about the COVID booster for 6 to 5 years old. So this would be the Moderna bivalent that we carry. If twins just had COVID, good question, what should we do the booster?
Right. So you qualify for the booster if you are 2 months past your primary series and you have not had COVID within 3 months. So 2 months past primary boost or primary series, and 3 months past any infection.
Excellent. Okay. While we wait for some more questions here from the live audience, also we got some questions from home, from the email that we sent. So let's see. Let's just pick one. Okay. So the question here is, my kids got boosted in October. They are 11, 13, and 14. When should they get boosted again? I think we just answered that question, but just to be clear.
Again, we just, 2 months past primary series or last booster, or and 3 months past any kind of infection. With your situation, we unfortunately do not carry the bivalent or any COVID vaccine above 12 years of age, just because we are unable to store it properly. But like I said earlier, many of the pharmacies around us have been super helpful and gracious and effective.
Mm-hmm. And then there's a question that is a little more logistics, so I'll take the question. The question is, my son has his 5-year checkup in March on a Tuesday. So the age is 5, the day is Tuesday. Will he be able to receive his booster on that day, or is it too far away and we need to reschedule or find a different date? The answer is 5-year-old looking for a booster on a Tuesday. The appointment is already scheduled, the wellness on a Tuesday. You don't need to do anything. On that day, when we confirm the appointment, we will ask you if you would like the booster because it falls exactly on the same day.
But let's say that's on a Monday or a Wednesday, right, and you want to just do one shot in and out, then I would call and schedule on a Tuesday for that situation.
Yes. All right. So I think this is pretty much it. Unless you guys have any more questions, we've been at it for 20 minutes. We want to let you go so that you can start prepping the dinner for Sunday and getting ready for Monday. I know we have to do that.
4:20.
I know. I need to start cooking. All right. Well, thank you so much for your time. If there's anything else, oh, we just got another question. Aha. All right. Let's see. I'm gonna put it on. So the AAP says 24 hours of counseling on nutrition if overweight after 2-year-old.
Yeah.
How would SSP accomplish this? Could we refuse the 26 hours? Yeah. I mean, these are guidelines.
These are guidelines. Nobody's gonna make you do anything that you don't want to do. No one's gonna like slam you if you and your child your child who is in dire straits doesn't want to start any kind of pharmacotherapy for it. These are all guidelines that have given a little bit more options to practitioners and to patients. These are not things that you're not a bad parent if you just don't want to talk about the intensive treatment and intensive nutritional family therapy. Nobody's gonna press a thumb on you to do it. It's this just gives us all more options, and in the big picture, it's really more options that will be covered by insurance. That is not going to be.
I think that you nailed it on this because they're so specific with that number, 26 hours of counseling, meaning that the insurance cannot say no at this point if the child needs it.
Right.
The other thing that I want to make sure that you guys all know, because we have received questions about it, is SSP going to change drastically how we approach the weight management?
No.
I
think a lot of our discussions for us and our relationships with our families, I think a lot of our discussions are taken to heart, and a lot of changes have been made. And I've seen great strides that I haven't seen in other places with the same BMI scenario.
Yep. All right, guys, we're getting ready to say goodbye. Thank you so much for your time. This will be posted on Instagram and also reposted on our website and in the Facebook group. If you're not part of the SSP family